Thank you for joining today's educational webinar with Cancer Support Community Los Angeles. I am Abby Espinoza, the Program Manager at CSCLA, and I'm honored to welcome you to this week's webinar titled Cannabis and CBD for Cancer, How and Why It Can Help. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you would like to learn more about our services or watch past webinars, please visit our website at cancersupportla.org. Before I introduce today's speaker, please note that your video and microphone are automatically disabled for this webinar. Please enter questions for the speaker into the Q&A feature found at the bottom of the Zoom window. Questions will be answered at the end of the presentation. We may not be able to get to all your questions today, but we'll get to as many as possible. Please use the chat feature to share comments and resources with other participants or to ask questions of CSCLA. We ask you to limit chat comments to information relevant to this topic. Dr. Sherry Yafai is a cannabis specialist and board-certified emergency medicine physician since 2009. She started her medical career at UCSD Medical School and completed her training at UCSD Emergency Medicine Residency in 2009. After recreational marijuana laws had passed in California in 2017, Dr. Yafai felt compelled to open a private cannabis clinic, the Relief Institute, to counsel patients interested in cannabis for wellness and disease-related treatment. She sits on the board of the Society of Cannabis Clinicians. It gives me great pleasure to welcome today's speaker, Dr. Sherry Yafai. Welcome, Dr. Yafai.
Thank you so much for having me here today. I appreciate the community and all that the community has to offer, and for inviting me back. This is a second lecture for me. Without further ado, we are going to jump right in. We have about a half-hour talk ahead of us. If you have questions, please go ahead and put it into the question and answer chat box, and we will get to them at the end. Again, my name is Dr. Sherry Yafai, and we're here today to talk about cannabis and CBD for cancer, how and why it can be of help. A little bit about me as we dive into this topic. I started off my career at UCLA as a neuroscience major as an undergrad, and then I went on to UC San Diego to medical school there and emergency medicine residency. I finished in 2009. Now it feels like eons ago. And since that time, I started working at St. John's Hospital in Santa Monica with multiple other smaller hospitals over the years. But I pivoted really in 2016. And I'll talk about that in a minute as to why I pivoted, and started my own offices at the Relief Institute, working with cannabis and hemp, CBD, all things plant-based. Since that time, part of what I've done is really interesting because most people don't think that cannabis is a very big topic, but in fact it is. And it's such a big topic that we've seen so many things emerging over the last about 10 years especially. Number one, I started working with the Society of Cannabis Clinicians. This is a nonprofit medical education organization that specifically works with educating physicians, nurses, medical staff, and more so that we can all get a better understanding as to the medical indications of cannabis. I started writing a column for Emergency Medicine News, which is a magazine that many of us read. And I joined the advisory board for UC San Diego's cannabis department, which has been a department at UCSD since 1996. Now, one other really exciting part has been that about 2 years ago, I was the recipient of a grant from the state of California alongside UCLA and 3 other physicians We're about to publish that article, hopefully in the next few months. So keep an eye out and open for it. Now, to pivot back really quickly, in 2015-ish, I had two family members who were diagnosed with cancer. And at that time, it was still medical only here in California. And both of them approached me and asked about how to use cannabis. I was unaware at all that there was any utilization for cancer. I had really very briefly seen a few patients walking into the ER suggesting that they use that, and kind of just shrugged my shoulders and turned the other way. But around 2016, it really hit me face on that this is something I need to understand and help. Both had oncologists who had suggested using cannabis, but had never stepped in any further than to say, go figure it out on your own, Google it, go to your local dispensary, and you can figure it out. One did really well. One was younger and, figured out how to smoke pot and managed. The other one was older and took too big of a dose and basically had a really bad reaction for about 2-3 days and swore it off and said, that's not for me. And so it got me to think about why we are having such hugely different responses, why it's even recommended. Like, why is this even a thing if we don't have physicians talking about it? So that's really what prompted me down this whole path. So that leads into exactly this. Weed, marijuana, cannabis, hemp, pot. I bet everybody here could think of at least half a dozen other names. Mary Jane, MJ, Mary and Juana, as one of the chocolates is listed here. It really is important to understand what it is that we're dealing with. So what is it? All of these things all describe the same thing. It is a plant called cannabis sativa L. This is the scientific name for what is commonly referred to as marijuana and hemp. Hemp is a subset of this plant where it is CBD dominant, or another way to say that is that it's less than 0.3% THC. Marijuana is actually how it's outlined in policy regulations, and this comes from a really in-depth discussion as to racism and what we were trying to accomplish here in the 1920s. It's a whole lecture in and of itself. But suffice it to say that really the laws are really important. This is currently a federally scheduled 1, equal to heroin medication. Globally, we're going to talk about some of the specifics. And as of about 2 months ago, our current president, President Trump, signed a expediting of this to get rescheduled into a Schedule 3 drug where prescriptions are available, and that it would be medically indicated. It has been technically medically legal here in California since 1996, and recreationally legal, meaning anyone over the age of 21 can purchase it independently, since 2016. We've had a number of other laws coming into play over the last few years that make it legal for people to use it in hospice care and in other situations in medical environments. Now, there's two really important parts. One is that the Hemp Farm Bill passed in 2019, and that meant that anything with less than 0.3% THC is legal federally across the entire United States. This really changes a lot of what we can give, what we can access, how we can access it, and taxes that are on all these different medications. As of April of 2026, so coming up here in just a few months, President Trump also signed another pilot project to allow for hemp products to be reimbursed up to $500 for cancer patients. So we are still waiting for all of this to come out and about, and how this is all going to play out in the medical arena. So what does all this mean? So I'm throwing a lot of words out at you, but I really want people to understand that cannabis, hemp, all of these big words come with really specific chemicals. So we're going to isolate out to 2 major cannabinoids. That's the actual chemical. One is called delta-9 tetrahydrocannabinol. That's THC, good old-fashioned THC. This is most well known for its intoxicating activities in the brain, but it's also very effective for sleep and pain management. The second major cannabinoid is cannabidiol, or CBD, also very well known. And this is the non-intoxicating chemical in the plant that is also active in the brain but has no abuse potential. This has actually been studied as recently as 2015 to make sure that CBD is not a new medication that we're introducing that can create addiction. This is where it gets complicated. This is the minor cannabinoids, or what I lovingly have referred to and termed the alphabet soup of cannabis. As you can see here, there's multiple other abbreviations and types of specific chemicals. Again, we're going to focus here on this talk on two primary chemicals, which are CBD and THC. So, what else is there? So I just showed you the alphabet soup. That alphabet soup keeps getting bigger. There's also terpenes and flavonoids and over 400 other chemicals in the plant itself. These are the essential oils of the plant, right? You know, every plant has them. Plants are not made up of just a single or two chemicals. They're made up of a variety of them. One of these chemicals is called beta-caryophyllene, which is also found in rosemary, so it's not unique. The rest of these essential oils are not unique to the cannabis plant. They're found in multiple other plants as well. And I find this interesting because beta-caryophyllene can also bind to the cannabinoid receptors, so it has some duality. Linalool is another terpene that's found in lavender that's also calming and is well known for good sleep and seizure control. Limonene is found in lemon, and myrcene is found in black pepper, I believe. The reason I'm showing you this slide is not to confuse you, but really to show you that the plant as a whole, just like every other plant, is made up of multiple chemicals, and it's a very complex character. What we are going to do is we're going to pick apart, again, THC and CBD in order to have a really much more simplified discussion, but there is a complex character underneath here. So, why do we care about cannabinoids? Why is this even an issue or a topic that we care about? In that image, you can see the flower in the background and pills in the foreground. And really, that's why we care about it. Because we're asking, can we do this in a different way? And why can we do this in a different way? The reason cannabis works, the reason why we can use CBD and THC in things like cancer is because our body has a natural occurring system that helps bring homeostasis into our bodies that was discovered over 30 years ago by Dr. Mechulam in Israel. And what we have found is that this is part of the body's natural occurring balancing act, right? So it is our body's yoga system. It is a feedback system on the presynaptic neurons, as sometimes these neurons can be involved in both pain and seizures, as two examples. And this is, I want to show you just a quick picture of what this looks like. This gets a little bit very scientifically heavy, but I just want you to see that we've got a ton of science behind this. Oftentimes people come to these talks and have no clue that there's real science behind this. So our body's endocannabinoid system, or our body's balancing act, is naturally a part of our metabolism, and it's called the endocannabinoid system. There's a couple main chemicals that our body naturally produces that mimics THC and CBD. This is called anandamide, 2-AG, PEA, and OEA. They're generated in the cell membrane from phospholipid precursors, and they also help metabolize our body's innate endocannabinoid system and also the outside phytocannabinoids, or THC and CBD in this example. We've got receptors like CB1 receptors and CB2 receptors on the cell membranes, and these help regulate multiple different organ systems. This is another image that you can take a look at here, where we can see that there's CB1 and CB2 receptors. And these, I don't know if you can see my arrow here, but we have things that bind called AEA and 2-AG, and also THC binds to these receptors. And it's really interesting that for another time for us to go through really how that flow goes. But there's two things really important here. One is that these receptors are also expressed in inflammation and our immune cells, both of which are really important in the process of cancer. Our natural system also breaks these things down. So our metabolism of both our natural occurring body system as well as the ones that we put in, such as THC and CBD, are going to get broken down by, again, our body's natural occurring system. So what you can see here is that the body's natural occurring system is located, these receptors are located across the entire body. So it's located in our brain, in our lungs and our heart, in our GI system, in our kidneys, our bladder, as well as our bone marrow. So this is really important because guess what? We get cancer in all of those systems, and also chemotherapy affects all of those systems. And what we're going to see here is that this is a pretty fantastic medication that we can use and alleviate a lot of those issues that we get as a result of chemo. Really briefly, I do want to point out that the reason I have this in bold here, that it's not located in the brainstem, is because one very important medication that we all have, at some point of our lives, most people have had is an opiate or a painkiller. And one of the reasons that opiates are notoriously problematic in cancer is because they are addictive, but also because if you take too much, it can stop your breathing. One of the things that I myself, as a prescribing doctor, find amazing about this medication of cannabis is that even if taken in excess, which I don't recommend doing, but even if taken in excess, there's no risk of death. On the other hand, if you take too much of a painkiller like Percocet, oxycodone, morphine, Dilaudid, there is a very real risk of death that goes along with it. So it's one of those things that we really emphasize, that this is a safer medication or drug. One of the reasons why we see cannabis working so well is because it's not just tied into these one or two receptors. It's actually tied into about half a dozen receptors. Remember, if we're going to help the body regulate, we have to recruit as many different people at different sites of the body to help that regulation occur. And this is just an example of all of those different places where it can help regulate your body and your system. Okay, so jumping in, does it all go up in smoke? What are the forms of use? Do I have to smoke pot? That's usually the first question people ask me. You do not. In fact, there are about a dozen different ways that you can use cannabis products. And I'm talking about both THC, CBD, and all the other chemicals that are available. Inhalation is probably the most common that we see out there on the marketplace. It used to be that flower was 12 to 30% THC. Now we're seeing it upwards of about up to 35% THC. You can vape both flower and oil. When we talk about safety, flower is inherently more safe than vaping oils, although occasionally people, especially in apartment complexes or shared communal spaces, the vaping of flower is a lot smellier and problematic than vaping an oil. There are things called dabbing, wax, and shatter. Those are never recommended or suggested. They are very high dose or high intensity THC products. You can ingest things like oils, including Rick Simpson oil, sublingual sprays, gel capsules, honey, tea, brownies, cookies, chocolates, hard candy, gummy bears, gummy squares, gummy rectangles. So there's a lot of different options in the ingestible variety. And then there's other products that have been made more widely available recently, such as sublingual melts, like a Listerine tablet or a Zofran tablet that melts under the tongue. There are topicals and pomades, creams, ointments. And then there's intervaginal suppositories that can help people with pelvic, uterine cancer, ovarian cancer, rectal cancers, but also can be helpful for other things like for sex and sexual intercourse and being more involved with a partner, especially as we talk about how some types of cancer can depress our desires and our capacity to have sex. So these are also really other important parts of our discussion. Lastly, there are also rectal suppositories, again, for the same purposes as the vaginal suppositories. Okay, so let's dive into it. You've had a lot of really heady stuff here about what these different medication types are, what they can come in different varieties, but why would we even use them? I find this quote to be the best one. Dr. Abrams of UCSF in 2016 in the Journal of Current Oncology said the following about using cannabis in clinical care. A single intervention that can assist with nausea, appetite, pain, mood, and sleep is certainly a valuable addition to the palliative care armamentarium. So really, what else can we use in the world of medicine that can have so many multiple positive outcomes is rare, is very rare as a medication, and is thought to be an amazing one if we get even 2 different perspectives accomplished. So this is really important. So I want to talk about 4 different phases of cancer and cancer treatment that we routinely see: pain, anxiety, nausea and vomiting, and insomnia. Pain. Pain is really challenging sometimes for cancer patients. Sometimes it's not an issue, but sometimes it can be a very chronic or intractable type of pain. In 2010, there were studies done using both 1-to-1 THC and CBD, as well as THC alone. And interestingly, what was shown in that study was that the 1-to-1 group, or the combination THC-CBD group, did best in terms of improvement in pain, whereas THC alone in that one study did not show any improvements in pain. Another study done more recently in 2026, just published in January, showed an improvement in pain management and quality of life across the board using cannabis products. It also showed improvement in severe anxiety, in poor sleep, and what I found was interesting was that women were more likely to respond well. Another study done in 2021 showed that using CBD for the treatment of anxiety reduced anxiety at 12 weeks by 40%. Now, this is really important because I think people oftentimes have this misunderstanding of cannabis products, that they use it once and that it's going to help everything get better right away and, quickly, right? And this really was near and dear to my heart because this is oftentimes what I find is that it does take a few weeks to get global improvements. Now, the other really interesting thing about this study was that it did find that this was the second study, that young people with CBD exposure did not have negative impacts on their brain. They actually found improved learning rates under certain conditions. So again, we have to be really careful about these medications, but we are seeing really wonderful improvements across the board. Another study done in 2025 showing anxiety improvements, specifically in cancer patients. After 30 days, patients showed a 30% improvement in anxiety, specifically again with CBD dominant products. And this study was done out of Minnesota, where we're getting a lot of feedback from their medical marijuana department. Moving on to nausea and vomiting. Oftentimes we know that some of the chemotherapies used can cause nausea and vomiting. And what we found in this study done in 2019 was that cannabis can help alleviate that. We've seen this so many times in so many studies, in fact, since the 90s, that there are prescription-based medications that are synthetic THC called Marinol. And this is available through pharmacies and in the hospital. THC has led to appetite increases in humans and laboratory animals, mostly in non-cancer contexts, but we're seeing that patients using THC could have better retention of medications, feel better, and globally do better. Sleep. This is our third part of what causes problems in our cancer patients. And one of the things that we found again here in another study in 2023, and by no means is this the only one, this is just the most recent study, that shows that we get an improvement in sleep using cannabis oils, both in the quality and the time of sleep. We see up to an 80% improvement in overall sleep, and that their natural occurring melatonin levels are improved as well. Again, this is about 2 weeks, so it's not just a one shot and you're done. This is 2 weeks of consistent treatment. We get globally improved, better outcomes in sleep. This is another study done just recently published, I believe 2025, again out of Minnesota, and this was done with 1,900 cancer patients, and again found about improvement in sleep disturbances by about 20%. That's pretty darn big when we come to talking about sleep. This is really important, things that are, again, chronically problematic and can overlap, right? That's the other beauty of cannabis. So just to review here for a moment, cannabis improves pain, anxiety, nausea and vomiting, and sleep disturbances, specifically as it has to do with cancer patients. Now, I do like to also touch on this because I think it is important. Cannabis is the only medication that I'm aware of that treats pain, anxiety, nausea and vomiting, and insomnia, and has a side benefit. Say this again, a side benefit, not a side effect, but a side benefit of having some anti-tumor effects. So I always tell my patients, what I will tell you all here today, which is if I could give you Zofran, for example, most people are very familiar with that one, and also have 20% positive effect on taking away your cancer, I would give you Zofran all day long, every day. But Zofran doesn't have that side benefit. But cannabis does. So here's 2 studies, one on GBM, breast cancer. Sorry, this one in particular is on breast cancer and cholangiocarcinoma, but we have the same or similar studies on both GBM, cholangiocarcinoma, breast cancer, pancreatic cancer, prostate cancer, and so much more, showing tumor reduction and treatment. Again, this is not a slam dunk like chemotherapy where we talk about 60 to 70% benefit and resolution, but we do see benefit in helping these cell tumors disappear or go through apoptosis. Here's another mice model of a glioblastoma case as well as a breast cancer case. You'll see here the rat model. Again, if you can see my cursor here, the rat model has a tumor, a GBM, that was placed in the pretend or the vehicle rat, and then the treatment model rat here. And what you see is the vehicle without THC treatment, the tumor is grossly larger than the one with treatment. The other reason for the 2 discrepancies in color is that it also causes a decrease in blood vessels or angiogenesis for with the use of THC. And again, we see the same things happen with breast cancer and lung cancer, lung metastases, where we see decrease or reduction in tumor growth, tumor number, and severity. This is another study done in 2023 showing CBD specifically inhibits breast cancer tumors. And here's another image looking at that from a mouse model, and we see improvement or resorption with CBD treatment here, such that there is no more tumor. This is the only slide I believe I have looking at something that's slightly different from CBD and THC, which is where I've been focusing on for today's conversation. This one is called CBG. G is in good day. But we are seeing new studies pop up as recently as 2021, focusing on a different cannabinoid to avoid potentially the use of THC. So this study also suggested improvement in survival. So instead of going from a 6 to 12 month survival to about 16 to 24 months of survival using CBG in addition. And this is, I believe, the last slide, using cannabis for pancreatic cancer and CBD and THC having potential benefits, again, as an anti-proliferative and pro-apoptotic effect on our pancreatic tumors. This is something that's pretty important Again, with tumors that we have had no prior treatment outcomes of benefit, we're seeing a potential to help reduce tumor growth and reduce tumor invasion. So now what? So now we've talked about 4 potential treatment strategies for chemo-induced nausea and vomiting, pain, anxiety, and sleep. And then we've also talked about using the same products as potential anti-tumor effects. So what do? We've got all this great information. My suggestion now is seeking medical care versus doing it on your own. So doing it on your own, DIY, people have a higher chance of ER visits due to accidental overdose, which is what happened to a family member of mine almost 10 years ago. Especially with seniors and pediatric patients, we are seeing this happen more and more often. Patients are more likely to talk to a bud tender, which is the person behind the counter who's dispensing these medications or drugs. And those individuals are oftentimes barely high school graduates, are not medically trained, do not have any medical education at all, and are giving you information based off of personal experience. This is not what I would trust my loved ones with for this type of medication. What does happen in an accidental overdose? Thankfully, it is usually very mild in that it may give some patients anxiety, panic, and cause their heart rates to go up, and then it goes away. There's not a lot of treatment for it, but it is supportive care. We do not see overdoses with cannabis, specifically THC, leading to anything lethal. Now, the other thing that I have seen patients do is try it on their own or do a DIY. They'll go to the bud tender or the local dispensary and they will literally purchase, hundreds of dollars worth of products, come home and feel overwhelmed by what to do and what to take and how to take them. This is not as easy as it used to be 20 years ago when all we had was smokable flower. It really has become very nuanced. There are over 10,000 products in the marketplace alone in California. So, why seek medical care? You are less likely to end up in the ER as discussed. There's cost savings for specific medications versus trying to try everything that the bud tender suggests. So, for example, having 10 to 20 different products in your home. You develop a personalized medical cannabis and hemp care plan. We get better long-term outcomes with targeted therapy approach. And ultimately, we do provide discounts in order to get you the medication you need with as many discounts as possible. If you have any questions, if you feel like this resonated with you at all, I look forward to speaking with you. Please reach out to me anytime. The best way to reach me is through email, sherry@mdrelief.com. And you can send questions to me or concerns. You can go onto the website, which is www.thereliefinstitute.com. Or if you go onto the website, you'll see here I've got a little picture of a number of different podcasts that I've been featured on. You can hear me talk, if this wasn't enough, ad nauseum. Again, thank you to the cancer program today for bringing me on. I hope that many of you find support and relief and that you can get through this whole process seamlessly. And we are going to open up to questions. Okay, so the dosage and brand you recommend for anxiety and pain, and what is your price? Great questions. So first of all, as you know, anxiety and pain are 2 very different things. And everybody is different. I don't give a standard recommendation for any of these things. It really tends to be personalized. I thank you for the question about price. My initial consult is $500 and follow-up appointments are $200. If you need assistance, please let us know. Type and form and dose of CBD or CBD THC for inflammation and how long before results. So again, these are very specific medication questions that are best answered individually. But in general, how long before results? For inflammation, in general, we're talking a few days to start, but ultimately, inflammation can take anywhere from 1 to 2 to 3 months to really see really dramatic results. Topical CBDs do work. I find them to be the most underutilized product on the marketplace. I'm actually in the works of making a topical CBD for radiation purposes. That is a combination of CBD, aloe vera, and calendula, and more, to get patients, especially radiation burns, to get them to go away or to prevent them from happening. If you have any questions about topical CBD for that purpose, please again reach out to me at sherry@mdrelief.com. What form and dose for breast cancer, and what type of breast cancer, hormone positive, HER2 negative. So again, these types of questions are going to be rather specific. We do see breast cancer all types. It is not specific to hormones because this is not a hormone-related medication as opposed to a tumor-related medication. Question just popped up. I don't take insurance, but I do provide patients with super bills if that is helpful to you. What do you suggest to get our oncologist to get on board with these options? Great question. This is really difficult. I've been trying to yell about this from the rooftops for 10 years now. I can't believe I'm still yelling as hard or as loud. The more patients kind of demand it of their oncologist, the more likely we are to move the needle. Unlike the pharmaceutical companies in the pharmaceutical world where there are, billions of dollars pushing these things on us as clinicians and physicians to learn about them. On the other hand, the cannabis industry is not organized in the same way because it is so easily accessible. And so because you don't have any one group pushing, with money pushing forward, we see this very disjointed moving forward. So I really suggest or encourage patients to remind their oncologist that this exists and to ask them about it. I always am happy to talk to oncologists that I know of if they have questions or if they want to be pointed in the right direction. You can always suggest they reach out to me directly or to take a look at my website. I do feature on the website, I didn't show you all of this, but I do also feature on their educational programs that I have done in order to get everybody understanding where the research is. I try and push research and information as much as possible so that we can all get behind this. I
think those are all the questions we received. Thank you so much, Dr. Yafai, for your very informative presentation. We do have time for a couple other questions that we received during registration, so I'll go ahead and ask a few of those if anybody else doesn't have questions. If you still have a couple other questions, please feel free to put them in the chat. But just to get started with the questions we received during registration, some people asked, so one of the questions was, how does cannabis interact with painkillers?
Oh, great question. So cannabis does interact with painkillers. So there's three main things that it interacts with, and many more, by the way. But the first is going to be painkillers, especially opiates. The second is going to be benzodiazepines, such as Ativan, Klonopin, things that make you sleepy. And then the third is hypnosedatives, and that falls into the category of things like Ambien, Lunesta. Again, things that make you sleepy or that are going to make your mind go to bed, these things will all interact. The best way to go about doing this is to not blindly take painkillers if you're using this. So I suggest people try to, what's the word I'm looking for here, stagger these medications. So if you are going to use a cannabis product, take that first and wait 1 to 2 hours before you decide that it's not controlling your pain, and then you can take your prescribed pain medications. Oftentimes that means that you can even take less. So if your pain is not as bad as it normally is, but it still exists, you can try taking half of your painkiller. That's an easy step down way to try and avoid overdoing it. Same thing with the benzodiazepines and the hypnosedatives. I suggest people try first with the cannabis products, and then if they're not getting benefit or they're still having problems, then they can add it or layer it on at a smaller dose.
Perfect. Thank you so much. Another question we received was, what are considerations one should take for people with substance use disorder?
Say that for me one more time.
Yeah. What are considerations one should take for people with substance use disorder?
Oh, great question. Okay, so I've had a number of patients who are either in AA or have a history of substance abuse. And it's really important because we don't want to create another addiction or create a problem. Now, for those individuals, it is imperative, it is so important to do this alongside a physician so that we cannot, I can't give you a blanket permission slip to use THC. That's a bad idea. On the other hand, if you want to do this on your own, non-THC, so no THC, is an easier pathway for you. Those are the non-addictive properties, or the chemicals with no addiction properties. Again, though, I strongly encourage people with history of substance use disorder, alcohol addiction, to do this alongside a physician, even if you just need a couple pointers, and that's the extent of your needs.
Thank you. And then another question was, does a cancer patient need to be 18 years of age to use cannabis for cancer?
Okay, so you can be you have to be 21 and over to walk into a dispensary by yourself, whether you have cancer or not. If you're between 18 and 21, you need a medical permission slip or a medical marijuana recommendation to walk into a dispensary. If you are under 18, you have to do this alongside a medical professional. So you cannot walk into a dispensary under 18 for any reason, even with a medical recommendation. If you have cancer and you are under 18, you have to do this with a physician. It is required by law in every recreational state and every medical state. So this is something that we have to do together.
Perfect. Thank. And then a couple other questions we received was, one was, are edibles safer than smoking?
That's a great question. I've gone back and forth on it a lot, so it's not an easy answer. When people smoke, depends on what they are smoking. So the healthiest perhaps way to use any medication, bar none, is going to be something you ingest, because your lungs were not designed to take in medicine all the time. That being said, for certain individuals, inhalation of flower at a low dose can be better than using an edible or an ingested product. And the reason I'm bringing this up is because cancer patients fall into this very unique group. If you feel comfortable smoking flower, which means inhaling flower products, is probably bar none the easiest and most effective pathway for chemo-induced nausea. That is, even over edibles, it is better and easier and more direct, and you're going to take a lot less medication if you go down that pathway. That being said, if we're trying to deal with anything else other than chemo-induced nausea and vomiting, yes, we are going to preferentially use an ingested or edible-based pathway to use THC products.
Perfect. Thank you so much. And one last question we received was, what impact does cannabis have on one's brain?
What impact does cannabis have on?
One's brain.
Good question. So, very specifically, we're talking about THC in this question. So the question should be, what impact does THC have on the brain? If you are going to abuse something, meaning you are going to use THC to get high daily, every day, all day, yes, it will have a negative impact. There's no question. Anything you use in excess is not good for you. So my example I always use is going to be cake. You could get away with eating a slice of cake a couple times a week if you're exercising and doing everything else right. Okay? If you eat a whole cake every day, no matter what, it is not good for you. Okay? This is like the most straightforward example I can use. If you are going to smoke pot all day long and get high and stoned all day long, that is not good for you. Okay? There's no question in my mind about it. If you are using small amounts of THC with a physician in order to treat your nausea and vomiting, pain, and anxiety, are there long-term negative impacts of THC? Potentially. Do we see it? Not really. On the same level though, we want to compare, okay? In the same breath, we're going to use THC. We're also going to say, what would you use otherwise? Would it be Percocet instead? So then we have to compare apples to apples. Which one is better for you? Is it going to be THC or is it going to be Percocet? And there's no doubt in my mind that THC is going to be better for you than Percocet. But again, apples to apples. We are not making blanket statements here. I think we have to get out of this frame of mind of, is it good or is it bad? It's not about being good or bad. It's about what are my options and what am I trying to accomplish, okay? If you are 15 and you want to smoke pot all day, that's probably not a good idea. If you are 45 and dealing with testicular cancer, yes, you should probably use a THC product to help get you through chemo and get you through this rough patch. Is this something you want to use permanently? Again, potentially, but we have to discuss kind of why. The whys are really important as to what we're using and how much we're using. Now, there's another aspect to this, and I'm going to go back to the cake example. Are you eating a slice of cake with a Coca-Cola every day, right? Or are you having the slice of cake with a glass of water? Okay? Everyone's going to say, duh, you're going to have a slice of cake with a cup of water to balance some of this out and not to give you a sugar overload. Same concept we're going to now apply to THC. We want to use THC with something to help balance it out, which is going to be CBD in this scenario. And CBD is really helpful to level off side effects that we get from THC. So again, it's this balancing act and not overpressing the gas in one direction. If we were just going to give one big blanket statement about THC in the brain, in excess, THC is not good for your brain. With appropriate dosing strategies and protocols, THC is not harmful to the brain.
Perfect. Thank you so much, Dr. Yafai. I think we got through all the questions, but if anybody else wants to reach out directly to Dr. Yafai, please feel free to note her contact information. And then I do have one last closing slide I can share. Dr. Yafai, we really appreciate you being here and sharing your time with us. Thank you to our participants who were engaging with us throughout the webinar. If you would like to learn more about Cancer Support Community Los Angeles, please feel free to visit our website at cancersupportla.org. And if you have any questions or would like more information about how to get started with our services, please feel free to email us at info@cancersupportla.org. Again, I wanted to share, we do have a few people living with cancer support groups. On the right-hand side, you can see the schedule for a few of the ones that we offer. If you would like to get started, please feel free to reach out to us. I'm more than happy to give you more information. Thank you once again to everyone joining, and thank you, Dr. Yafai. We hope to see you all at a future webinar. Thank you, everyone.